Back with Dr. Ghatan, dermatologist in Brooklyn. Dr. Ghatan, a lot of people go to somebody like you in order to remove unwanted hairs from all different parts of the body. And apparently that's not quite as simple as it, one might think, well, why don't I just shave him off? But that doesn't give you that smooth, beautiful, like us guys, we have a little, beardy look all the time. That's just not what, let's just say, a lady and sometimes even a guy in some areas wants. Tell us about hair removal, how you go about it, and how the technology improved there, if it did at all.
Yes, hair removal is an interesting and very popular treatment. It's basically the lasers for hair removal came out maybe over 10 years ago, and there's been a lot of improvements over the years. Before lasers were available, people were doing electrolysis, shaving, waxing, or other treatments. But laser has an advantage because it can cover a large area of this skin and can remove a lot of hair at one time. And they have developed new technology that makes the hair removal much less painful and totally tolerable. And the speed of hair removal is faster than before. The only thing is that I don't think we have really perfected the technology to remove the hair permanently. That is something that sometimes some people promote, but I caution my patients. I tell them, look, we cannot remove the hair permanently. We can help you reduce the hair. You're going to have less hair than you had before. You're still going to have some hair growth in the future. Normally you need treatments once a month, again, depending on what part of the body. Say for the face, once a month is reasonable, and at least 5, maybe 7 treatments. And after that, we advise the patient to come back for touch-ups, maybe in 2 months, maybe 3 months. In ladies especially, if there's increased hair growth on the face, we want to know why. We're not just there to remove hair. We want to know what's the underlying cause. And we often try to elicit that, to find that out by taking some history. Sometimes we may want to do some blood tests. And if need be, if we suspect some hormonal problems, we may refer them to endocrinologists, especially who deal with hormones, to deal with the cause of the problem, which may have other issues involved as well. And then we tell the patient, yes, we can help you with the cosmetic treatment of the hair, and we can help you decrease the hair, we can remove it, and you go from there.
Wonderful. So it's not only about removing the hair, which did become easier and better, but there is still the growing of it, and especially sometimes there's excess growing of it, and then you want to check what hormones are maybe out of balance or whatever it might be. And being a dermatologist, and skin and hairs are growing on the skin, so you're then well versed in if there's potential solution, and to basically get rid of the source of it in the first place.
Address the source of it. I don't know if we can get rid of it, totally address it, yes.
Try to eliminate it. Whether we succeed is then slightly, but at least help out on it, because any slowing down of original growing probably must be welcomed by a patient, right?
Of course, yes.
Good. Well, here we have it, a technology to remove hair. And obviously, so do you get more people during the summer months to want to do those things, hair removal under the arms and stuff like that?
Oh, yes, for sure. Yeah, the legs, the arms, the underarms, especially the ladies feel a bit more conscious about it. It's a matter of self-image and feeling good about themselves, and they come to do it more for the summer. So too when they come for removal of spider webs on the legs, they when it's summertime they're more interested in doing that. Sure.
Right. Well, I remember when I was 18 years old, 17 or so, I was rather disappointed why I didn't have to shave constantly, because that was very unmanly. Now that, I'm a couple of years older, I wouldn't mind skipping the shaving. Anything we can do there?
Well, there are men who come to us who have very thick beard, and they have to shave twice a day sometimes. And we do the laser for them. It does decrease the hair. It doesn't remove it 100%, but they don't have to shave twice a day, maybe once a day or maybe a day and a half or so. So it helps them that way too.
They still look civilized when they leave the office at 5.
Yes.
Wonderful. Well, thanks, Dr. Ghatan.